When it comes to somebody who is overweight or has type 2 diabetes, you mentioned intermittent fasting. There are so many different ways that somebody could do that. Is there one way you found working with clients that's more effective?
Really, they can all work. And because anything that you do, like fasting is simply the sort of opposite of eating. So if you eat, you're storing energy. If you fast, you're using energy, right? So then where do you get the energy from? Well, you get it from your blood glucose, which is blood sugar, or you get it from your body fat, right? Those are the ways you store energy. When you don't eat, those are the ways you use energy. So any of the regimens can work. The most popular would be 16 hours of fasting and 8 hours of eating. So that's a 16-8. One meal a day, which is sort of a 24-hour fast. Those are probably the most popular, but there's nothing to stop you from doing anything sort of less or more. The standard amount of fasting you have to keep in mind. So remember, if you go back to the 70s and the way people used to eat, which is finish dinner by about, say, 6 o'clock and then eat breakfast at, say, 8 o'clock. That's a 14-hour period of fasting that people did every single day without even thinking about it. Okay, 14 hours. That should be your baseline. So now some people say, I'm doing fasting every day. I'm like, how long do you do? They're like 12 hours. I'm like, that's just regular eating, right? It's not, you're not getting nearly enough time for the body to use its energy. So remember, when you eat, you store energy. When you don't eat or when you fast, you use energy. So if you're only giving your body 12 hours, when a normal day should be like 14 hours, you're not giving your body enough time. If you want to lose weight, then you simply push it up. So you can go 16 hours, you can go 18, you can do 20, you can do 24, you can do 30, you can do 36, you can do multiple days, in fact. As you go longer, of course, it's more disruptive to your sort of normal schedule. And you have to be more careful if you're taking medications and so on. In fact, if you're on medications, you really need to talk to your doctor about it in case any of that is affected, because the medications you're prescribed are often with your current diet, adjusted to your current diet. So when you change your diet even, you should really talk to your doctor, because some people go on a low carb diet and they actually need so much less insulin, for example. So you really can do any of those, but 16-8 and 24-hour fast, which is OMAD or one meal a day, typically work the easiest for most people. So therefore they can implement it the easiest, but there's nothing to stop people from going 2 to 3 days or if they want to.
For somebody who is type 2 diabetic and their body is just super saturated with sugar, they have fatty liver, fatty pancreas, fat distributed throughout the body, how long does that take to start clearing up? If somebody starts doing, say, the odd 24-hour fast or even the 16-8, how long does it take before the liver starts to let go of some of that fat and the body starts to begin to heal?
It's hard to answer that because it all depends on sort of how long you fast for and what your underlying baseline was, right? So if you had a lot of sugar, it might take a long time. If you look at studies of bariatric surgery, so remember, bariatric surgery is where they sort of cut your stomach so that's like the size of a walnut, and then they rewire your intestine so you don't absorb any nutrients. So in essence, it's like fasting. It's just sort of surgically enforced. You can take somebody who is a very severe diabetic and if you put them on a fast, like, bariatric surgery, which is like fasting for multiple days at a time, many of them within like 3 weeks, 2 weeks, will actually go to zero, and like they'll get off all their insulin. So it can be very rapid. If you are just doing the shorter ones, which of course give you a bit more of a controlled, drop, it can still be very fast, like within a few months, but sometimes it can take longer. It depends on how long you're fasting for and what you're eating sort of in between. If you're taking one meal a day, but that one meal is full of, processed carbohydrates, then, you're undoing a lot of the good that you did. So you want to stick to a proper diet, the fasting, but it can be very rapid. I mean, I did a case series of a few people who they just implemented a 24-hour fasting period. They were all on insulin, and within a month, all three of them were off of all their insulin. And they'd been on the insulin for like 20 years, right? So 20 years, they got off in a month, right? With 3 days a week of 24-hour fasting. So now that's sort of on the optimistic side. Most people won't get those good results. But on the other hand, if you do it, you can do extremely well. It can reverse actually very quickly, which is, very encouraging.
Let's talk about this from a basal metabolic rate standpoint. So, traditionally, people have been taught you want to lose weight, you want to increase your exercise, cut your calories. So, let's talk about basal metabolic rate in that case versus fasting. And start off by talking about what basal metabolic rate is.
So basal metabolic rate is the energy that you use sort of at rest. So this does not include exercise, because exercise is your skeletal muscles, right? You run, you use your muscles use energy. So that's great. In fact, exercise is very good for you. However, if you look at the entire day, you generally need a lot more calories for your heart and your lung and your brain and all that sort of stuff. So a lot of people are burning somewhere around, say, 1,800 to 2,400 calories per day, even at rest. When people do exercise, again, it depends on how intensive the exercise is. But, for older people, say they do a little walk around, for 40 minutes or so, it's like 110 calories or something. So you see that the magnitude is far off. So even if you exercise every day, and again, I'm not talking about the people who who do a marathon, right? You're burning way more calories. But for the sort of average person who's just doing sort of a bit of modest exercise, it's like 100, 200, 300 calories. And if you ever gone to a treadmill and looked at that, the calories burned scale, you'll know it goes very slowly. And remember, that's because when you exercise, you're only using your skeletal muscles. So that's only one small part that's increasing. Your liver is not using more calories when you exercise, right? Your brain is not. So out of all of your body, the exercise only increases the energy requirements of that one compartment, skeletal muscle. Not your lungs, not your liver, not your kidney, not your bowels, not your brain. They're not using more energy. So that's why there's such a modest increase in energy expenditure with exercise. Now, the thing is that, 2,000 calories a day versus that extra sort of 100, 200, 300. You see that most of the energy, that's why exercise is just a very inefficient way to sort of lose weight, and it's, and take care of type 2 diabetes. If you simply don't eat for one day, you're going to use 2,000 calories, because that's going to have to come out of storage, as opposed to if you're eating regularly and exercising, where you're just using an extra 200. So if the fasting is sort of like much more effective than that, because you're really letting your whole body use the energy that's taken out of storage. And remember, if you're overweight, if you have high blood glucose, your body has too much energy. It's just a matter of letting your body use it. So if you're using 2,000 calories, your body fat stores might have 100 or 200,000 calories sitting in it. So is it going to matter? No, not really, as long as you do it properly. The basal metabolic rate does tend to go down as you lose weight, but the other thing is that fasting tends to preserve it better than simple calorie restriction, because you get these other hormones that go up, such as sympathetic nervous system and so on, which will increase your basal metabolic rate. So that's why exercise is not that important. The fasting in particular might be more beneficial in terms of basal metabolic rate, which is why in the long term it may be more effective as a sort of strategy for weight loss.
When it comes to the exercise piece, when you're working with clients, you talked about exercise as a whole there, but what do you think about using, say, a 20-minute walk after a meal to help bring that blood glucose down?
That's actually a great way to do it, actually. So going for a walk after a meal, because what you're doing, of course, is that you're allowing the body to use the glucose that's easily available. So you're not going to get the same spikes, because as you walk, your muscles are going to need to use some glucose, and you're at that moment in time, the glucose that you're going to use is from the food, so it's not going to go into storage that you're going to need to take it back out. It's just going to get used. So going for a walk right after a meal we have good studies now that show that that's actually a really good way to lower that sort of spike in glucose after a meal. So it is quite effective. I mean, there are other ways to work it in too. So the other one that people use a lot is sort of training in the fasted state, which is where you fast and then you exercise and then you eat, which is again sort of a good way to do things if that's what you like to do. But walking after a meal, some low exercise, because you can't obviously do intensive exercise after a meal because it's very difficult to do that. But so some low intensity exercise is well placed to do right after.
Let's get into the details of the dietary piece. So somebody is going to start including fasting, maybe walking after meals when possible. If they want to go low carb, high fat, how hard do they have to push that?
I think that it's, low carb is one thing. It's everything sort of works. So they're just like different levers, right? So you can change the diet. You can lower the amount of carbohydrates, for example. That's one way that you can affect things. But there's other ways to do it. You can also change the carbohydrates to unprocessed carbohydrates. So that's going to change something completely different. You can use intermittent fasting, which is completely different, where you don't eat at all. So you can change your diet, you can change the fasting periods, you can change the exercise. When you're talking about the dietary piece, there's obviously a lot of discussion. Like there's always a lot of debate about that. But to me, it's like that's only one part of it, right? You're arguing about the diet, but people haven't looked at the fasting period, which is an entirely different aspect of it. Exercise, we all agree on. Everybody knows, everybody agrees exercise is very good for you. But the dietary piece, you can make it work because whether you're, low carb or low fat or keto or paleo or whatever, you can generally make it work as long as you're eating sort of unprocessed food. So people who eat a whole food plant-based diet, you can do very well with that because again, when you're eating whole foods, it's different. What was dangerous was not necessarily the carbohydrates, because people have been eating carbohydrates for a long time, but it's that highly refined carbohydrate where you're getting that huge spike up and spike down. If you're just eating beans, for example, and you're just getting sort of a slow rise in glucose and then a slow drop, well, you've got tons of fiber, you're getting filled up, you're activating your satiety hormones through stretch receptors. Well, that's not so bad for you. Like there's nothing to really be afraid of from that standpoint. But it's the sort of refined stuff that quick rise and quick drop. That's why, a lot of times we focus on the macronutrients, like carbs are bad or fat is bad or, proteins are good. But really, we shouldn't be thinking about things like that. We should be thinking about sort of foods instead of nutrients, because certain foods, even if they're the same carbohydrates, are metabolized very differently. So if you're eating white bread versus beans, there's a huge difference. You just have to look at like the glycemic index of white bread versus beans. So the glycemic index is this index of how high your glucose goes up per 50 grams or 100 grams of carbohydrate. So when you eat those two foods, both have the same amount of carbohydrate, your body responds quite differently. White bread goes way up, beans don't. Still carbohydrate. So the whole idea of just counting carbs, it captures one aspect of the diet, but not all of it. So that's why, so some people who don't want to push it, well, the main thing to push is make sure you're eating sort of whole foods, because if you're eating whole foods, you're generally going to be okay. Unprocessed foods, you're generally going to be okay. Because people used to think, well, if I'm vegetarian, I'm going to be healthy. No, you could eat, pizza, French fries, and chocolate donuts all day long and be completely vegetarian. It's not healthy. Nobody thinks that is healthy. ever, right? And that's why people are like, oh, it's now whole food vegetarian or whole food plant-based. And I think that's much healthier because you're acknowledging that, there's a big difference between eating salads all day long and eating French fries all day long, or eating chocolate donuts all day long. Like, that's vegetarian too, but not healthy. It's not that it's plant or meat is what makes it healthy. It's, is it whole food or not? And that's the same with carbohydrates too. So you don't necessarily have to push it that hard to be low carb, but you really have to push the sort of unprocessed foods more than anything else.
I like how you refer to these tools as levers. And I think it's going to come down to the individual case for the person, how many levers they want to pull at once. So, going ketogenic or really low carb for somebody that is type 2 diabetic, that might be where they want to go because they've gone so far down the continuum versus somebody who's just maybe in the obesity part of the continuum. So I think each person needs to consider where they're at, how fast they want to regain their health when considering all these different tools or levers that we're talking about.
Exactly. And everybody responds differently too, because you can put two people on the same diet. So all the dietary studies show this, right? So you compare, say, two diets, low carb versus low fat. On general, low carb does a bit better in terms of weight loss. But when you look at the splay, it's huge. So some people on the low fat diet do very well and some people do very badly. Same as the low carb. So you can give them the same diet, but each person will respond very differently. And that's why people get into these huge arguments, especially on Twitter, where they're like, oh, it's all about calories because, it's all about carbs. It's all about this. It's like, that's because that's their experience, which is valid for them, but not necessarily valid for somebody else. It makes no sense when we know that everybody responds so differently to these different diets to say, this is the diet for you, right? It's like, you need to try it and see what works, but there are some general principles like cutting out sugar, cutting out refined foods, that are going to be universal. Make sure you have these diets wars that go on are sort of tiresome because you have all these people who say that this worked for me and therefore it's great, but it may not work for the next guy, right? It simply makes no sense. It's like somebody who loves sushi who's insisting that, it's so great, but the next guy who hates sushi, or the one guy who loves coriander and the next guy who hates coriander, trying to convince the other that, coriander is the best. Coriander is where. Why argue? Like, you like it and you don't. Same thing for diets, right? You responded to it, but you didn't. So therefore, this person who didn't respond needs to find something else that does better. Doesn't mean that the person who did respond was wrong, right? That's the argument that always goes on, especially like, oh, low fat, whole food, plant-based, paleo, this, that. Like, it worked for you. That's all you can say. It may or may not work for the next guy. The next guy is going to have to figure out what works for them. But the general principles, as I said, are probably universal. On those, we probably don't disagree that much. Cutting out sugar is one of the main principles. Cutting out refined foods is another main principle I don't think anybody disagrees on. Exercise is good, but inefficient for weight loss. That's, pretty true as well. And then the fourth one, which I've always harped on, which hadn't been sort of touched on for a long time, was make sure you're not eating all the time. Because prior to me talking about it, honestly, the conventional wisdom was eat all the time to lose weight. Like, does that even make any sense? How can you eat to lose weight? You can only really lose weight when you're not eating. So why would you eat all the time? Like, it is completely nonsensical. It came out of that whole sort of low-fat hysteria, right? But whether you're low-fat or low-carb or high-protein or low-protein or plant-based or non-plant-based, that one you actually have to figure out for yourself because there actually is a huge inter-individual variation between the two. The general principles you can keep the same, but the specifics of the diet you have to work out a little bit for yourself because, everybody's a little bit different here.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
They were all on insulin, and within a month, all three of them were off of all their insulin. And they'd been on the insulin for like 20 years. Right? So 20 years, they got off in a month. So calories are a distraction because